Good afternoon, and thank you for joining me. My name's Tom Flanagan, and today we are going to be chewing over the recent Therapy Live conference. And there's a lot to talk about, right? It was eventful. Some brilliant, in a brilliant sense, some not so. So we'll talk about those as we go through. But before we jump into the day's topic, I want to recap what's happened since I was last on air in the world. Firstly, Freedom Day. Didn't really happen, did it? We've had a few more. Well, whatever that means, whatever your view on it, it's extremely divisive, more divisive a topic than I've ever known. Even Brexit wasn't quite this divisive from what I've seen. Having said that, the one thing that I think everyone is together on is the false hope and the failed projections that have been continuously promised by our government. It's uncomfortable. It's difficult for everyone in every walk of life, whether it's trying to plan things that you need to do to live, or things that give your life a sense of purpose. It's really quite rubbish. So yeah, not very positive on that front. Of course, we now have more promises. We're going to be released. I don't even know the date anymore. So we're just looking forward to that. Although I'm not holding that much hope to that specific date. Let's just see what happens. So Freedom Day, which I was so looking forward to, actually just turned out to be Monday. Anyway, moving on to something a bit more positive, which was got a list of things here, and the next thing is the Friends reunion. If you watch Friends, if you grew up in my generation and you did watch Friends and you've not watched it since it came out, go and give it a go. It was absolutely brilliant. Thoroughly enjoyed it. A little bit of a bright spark to some miserable news around the things that are going on at the moment. It was really cool. Genuinely really enjoyed it. Worth a watch. It's not what I thought it would be. Biggest news, of course, is that football is coming home. Apparently, again. Also, my friends keep telling me, but the Euros have been absolutely great. So, yeah, I've been thoroughly enjoying it. Some unbelievably good games, but a little bit more farcical decision making around COVID. I have to touch on it is the young fella from Scotland. Is it Billy Gilmore, who tested positive for COVID? Bit of disagreement between me and my friends around this. Some people hold the view that he's young and he's with young people, therefore should he even isolate at all? When do we reflect on the decisions that we've made and what we've been following, and when do we say actually we need to stop testing everyone for these sort of things? Some on the other side of the argument of urging more caution, ranging from he should isolate him alone to, well, if one or two people are isolating, then surely everyone should isolate that he's come in contact with. It's all just a bit bizarre and confusing and not particularly fair on anyone, right? So tricky again. Holidays was supposed to be, well, there haven't been many promises around holidays, just promises to myself that surely at some point we'll be able to go away. That's what I'm looking forward to. When can we travel a little bit? Because that is one of the things that gives my life most value. I love seeing the world. It'll be interesting to see what you guys enjoy. So got 24 minutes left. I'm going to be talking about Therapy Live in quite some detail. I can see some people are joining us at the moment. As you'll know, a lot will be joining us after. So if you are joining after, hope that you got a lot to look forward to. But if you are here live with myself, like Talita, nice to see you. Let me know what you're looking forward to in the chat. It'll be really cool. All right, so that's my review of the past month. It was supposed to be much different. Yeah, it was supposed to be Freedom Day yesterday, so I was supposed to have a slight hangover. Now, of course, it's Tuesday. I wouldn't do that. Anyway, the big topic of the day is Therapy Live. An obvious place to start is an apology. Now, there's been loads of apologies by loads of different people, but it's genuinely really important because the team, particularly Jack Chu and Jack March, and everyone in the team are the notion that something that we've tried to provide to you has led to so much stress and essentially wasted time. It's not pleasant. So a genuine apology. There's loads of reasons, well documented. If you do want to know more, head over to Twitter and yeah, Jack's posted out a really lovely message for you guys to read there. Ash James jumping in with some really important detail, reviewing my coat behind me. I get cold, Ash. I get cold. Anyway, knocking me off my flow. So, genuine apology. And I really hope you've managed to make the most of the extended offer from the team, which I can't remember all the details because there was so much. There was the Tom Jesson sciatica book, which I've got, read, awesome. Really, really important, particularly in my role in primary care as a working in like an APP role, which is kind of an orthopedic triage. The lines have become blurred over recent times, but yeah. So understanding radicular pain, radiculopathies, the pathophysiology behind it, and everything about it. It's a great book by a great person. So. Jesson's book, access for, I'm not sure how long it was, whether it was a week or a month to all the recordings. I don't even think it was just this year's recordings. I think he got previous recordings. So really cool, and I hope he made the most of it. On the topic of moving forward, which is really important, I don't really know what's going to happen with Therapy Live, but personally, I hope it continues. I hope it grows as it has done over the past year, because I personally have because I know the people who run it. I have a lot of trust in them to do everything they can to provide good quality, forward-thinking content. And if you follow the Physio Matters guys, you'll know that as well as I do. But I've worked with Jack, and I know that he's probably one of the most honest people I've ever met. So yeah, he's him and the team that he's got around him. I can't think of more honest people to drive that forward. So I hope it continues. I'm not sure what the plan is. That's honest. I'm not sure. But like I said, if it does move forward, I couldn't think of many people that I know better placed, better motivated, more honest and more invested people to drive this forward and make it better and make up for the mistakes that were made last time. But that's the conference itself. There were a lot of really cool things that went on. So what I'm going to do is I'm going to go over the talks that I moderated and highlights from them. We had the adolescent knee with Michael Rathleff, and we had heel pain also. So we're going to go over those. But before I do that, I'm going to go through the conferences that I didn't get to see, and how I'm going to plan and get through them this year. Because last year I've had access to the talks through the offer that you can get if you go to Therapy Live. I think it's like 50 quid. You get access to all the talks forever, which is pretty damn good in my opinion. And I still haven't caught up with all of the ones that I wanted to watch. So I'm going to be doing that. I'm still trying to do it, but I've come up with a plan this year, right? And quite literally a plan. It's like I'm having my own mini conference in Jacket Land, as Ash would call it, I imagine. I'm interested to know what your highlights were. So I can see Talita's pop some up on for me there. I'll bring those out in a second. And also Joe's popped a comment. Joe Turner, who runs MEHAB. If you don't know about MEHAB, you should. If you're a therapist, Google. Great resource for your own well-being. Joe's just reiterating the apology and the motivation to get things right. Anyway, so on the topic of this year's conference, what were your highlights? Pop them in the chat box. Let me know. But here are, before I go over my highlights, here are the things that I'm going to look at moving forward. So, talks that I didn't get to on the day. This year, because I've got a bit more headspace, I've been a bit more prepared, and I've split things into 3 categories. Category number 1 are topics that I'm interested in, but aren't necessarily in my comfort zone. Yeah. Topics, so things that kind of interest me, but they don't make up a significant amount of my workload. So that's curious outside my comfort zone. My next category is topics that I'm curious about, but are inside my normal area of expertise. Not to say that I'm an expert in these topics, just topics that I should be more familiar with. And then the final category are need to know. So simply cannot miss for me in my job role as an APP and doing FCP clinics as well. These are talks that I just couldn't justify not catching up with. So that's my system. Next June, I'll tell you how it went. But let's go through it. So I don't know if I put Ash James's talk in it, so it could be quite awkward now that he's watching. I'm going to start off with Ash's talk, which was actually I think it was around learning, which is like a massively important topic. Ash, just shout at me if I'm wrong there. But Ash Jones, James Jones, did a talk on learning. I've closed the webpage, Ash. So if I've got the name of your topic wrong, please do tell me. I'll give it a shout out. Bit of publicity for you there, mate. Right. So I'm going to start off with the curious and things that I'm familiar with. So first one is Brad's Neal talk around the role of strength in the development and recovery from patellofemoral pain, patellal kneecap pain, right? Find Brad and his team's work really interesting because it challenges my thoughts, which are a little bit more vague in clinical practice, but they offer very specific questions to challenge my practice, as to say, well, why aren't you doing these sort of things? And you probably should be doing these things. And I'm going to come on to that with Dylan Morrissey's talk in a little bit. So I love listening to Brad talk for that reason. Really challenges my view on an area of the body that I treat quite a lot, or see people who have pain around their kneecap. Really looking forward to the talk around with, I think it was a panel or just Roger Kerry and Jack Toog talking around pain and causation. Must admit, I'm a little bit apprehensive on that topic, pain and causation, because it's confusing enough working in APP and FCP, and with more risk, you kind of, personally find it harder to welcome the vagity that comes with questioning how we apply cause to structural diagnoses and things like that. Really important topics, and something that is inside more because it's pain, right? And if you're MSK therapist, pain is central to what we do. But yeah, it's a topic that could offer a lot more questions than answers. And at my stage of development, going into these FCP roles and continue with my development along the APP roadmap, maybe not for me right now, but probably one of the most interesting talks on there. Nadine Foster, I believe Nadine is heavily involved in NICE. So if you're looking for good quality source of information, you're going to struggle to get better quality than Nadine. Nadine's talk was around addressing the challenges of lower back pain. So well within the area of what I see on a day-to-day basis. Sarah Hogg, goal setting. Ben Cormack, do the secondary benefits of exercise justify its use for pain? Which is an argument that I've put forward quite a lot of the time to justify what I do in clinic. Maybe moved away from it over the past 12 months. But I think it's a really interesting question for two reasons, because the answer to that question might be yes, depending on your perspective and your views and your values. But also, if we don't incorporate the secondary benefits of exercise to justify its use for pain, we might be struggling to justify prescribing exercise and pain generally, which is quite I pose that as a question rather than a remark, because that's quite that could get me thrown under a bus a little bit. But Ben Cormack's talk, and Ben's awesome to listen to, fun, informative, well-informed. His talk, do secondary benefits of exercise justify its use for pain? Yeah, that would be an awesome talk to listen to, and one of the ones in this little category of my mini conference I'm going to be doing on my own. It's there, right? So last one in my comfort zone, and I'm not really sure if this is, but it's Janet Thomas talking around bow density, and the talk is titled "What Could and Should We Do About It?" So I put this in my area of interest and comfort, not because I'm overly comfortable with it, not because I have a great understanding. It's just, I think that it's the norm in MSK practice to not have a great understanding around how we can use therapies to help with that. But I've done a bit of reading, so kind of it was on a knife edge for me, so I've chucked it in there. And also, I listened to Janet talk last year, and one of my favourite Therapy Live talks that I've been to a lot. So yeah, they're my curious, but probably the ones that I could not listen to, justify not listening to, but I really want to because I find them interesting, which is probably why I've listened and read and done so much about it. The things that are probably more important for me are the category things that I'm curious about, but that are outside my comfort zone. So things that kind of they're not as important as the absolute need to know, which I'm going to come on to in a second, but they're things that I probably need to get more familiar with. First talk is by Val Jones. Val Jones, if you don't know, is a specialist in a specialist physiotherapist in the management of elbow pathology. I don't know if that's the best way to describe Val's role, but I hope I've done it justice. Really well known, really well thought of expert in that area. So Val's topic for the day was the stiff elbow, which, if you do work in MSK practice, is something that every once in a while comes up in a lunchtime discussion. And there's usually one guy who knows a bit more about it than everyone else. So but we don't seem to find a lot of information around it, either because I don't go looking for it because I don't see it that often, or maybe I just don't recognize it that well. That's why I'm going to listen to Val's talk. Or because there isn't a lot of information out there. And due to Val specializing in that, I think she works in acute care, so she'll have those good relationships with our medical colleagues. So hopefully, well, I imagine, I have no doubt really that it'll be a great talk. James Noakes, again, heavily active on Twitter, really engaging medical colleague who specializes in the management of MSK complaints. And his title is Pain in the Arse. So talking around gluteal pain, stubborn gluteal pain. It's something that, again, sort of like the stiff elbow, comes up in conversation, but not that much in clinical practice. Maybe I need to get better at recognizing it. But again, one of the reasons why that's high on my priority list. That's one on the list of things outside my comfort zone. And things that I need to get more familiar with. Dynamometry with Scott Morrison. So quite clear, it's something that it's probably been certainly undervalued by myself historically in my profession, and by those around me potentially, hence why I don't value it. But I think I need to revisit that and question whether I should value it more. So that's why I'm going to go in there. I don't want to miss a really important tool that could be helping my patients. But that's mine. I'm just having a look here. So Talita's talking about looking forward to first UK holiday since November 2019. Yeah, I think he timed it well with the weather as well, Talita. So enjoy that. Don't rub it in too much. Don't rub it in too much. This guy needs a holiday. Anyway, so most important category for me, and the reason why I've gone through this is because it was a reflection of mine. I thought it might help with you guys, and a bit more of a systematic way of planning your CPD and using the Therapy Live talks to do it. So I'm going to split this into 3 days over the coming 12 months and kind of go through the ones that I need to know about most. And this is where I'm going to start. So the first talk is, I haven't got the talkers' names down here. Apologies, but everyone's name is on the website on therapylive.co.uk. So we've got the presentation of gout and pseudo-gout, something that, massively important because recognizing that, or being able to recognize and differentiate and reason through a joint that is angry and acutely presenting is massively important. And it's also not a conversation that's happened a lot as far as I'm aware, and maybe because I've only been doing APP stuff for a couple of years, but I haven't come across it that much. Second thing, so these are the big juicy ones. I think Rob Tyler was involved in this talk, and that is, I think it was a panel discussion or a joint presentation around the reasoning, differential diagnoses, and managing bilateral leg pain. And with the clinical knowledge summary from NICE a couple of years back, throwing the cat amongst the pigeon with the bilateral leg pain being something that should be managed or heavily thought of as needing an emergency pathway of care. It's a topic that is massively, massively important. As is lumps and bumps. This talk is by Mike Dare. Mike Dare is a specialist in rheumatology, physiotherapist. Had the privilege of hearing Mike talk a few times, and he's brilliant, really, really well informed, and offers quite a what's the best word here? A real life way of using his knowledge. Yeah, he's not an idealist. I hope he doesn't mind me saying that, but I don't get that vibe from him that, absolutely you should follow this way. He's very reasonable, and I imagine the question and answer section of that would have been brilliant. And then the last two talks that I really need to catch up on are Joe Gibson, Indications for Surgery. I imagine that's on shoulders. Joe's never miss an opportunity to speak to hear Joe talk. Brilliant, lovely lady, really well informed. And finally, the magical Adam Dobson talking around lumbar stenosis. Very similar comments to Joe. Extremely well informed, and yeah, you can't really miss that talk. So they're my 5 need to knows. And that's how I'm going to go through this over the next year, and how I'm also going to make the most of the access that I have and you guys can get if you I think it's something like 50 quid or 70 quid or something like that. It works out at 70p a talk, which is extremely good value. Just before I leave, so I'll be back again next month. The aim is to have a guest with me. And that will be a theme throughout the next few months. But I was really fortunate to listen to Michael Ratliff talk around adolescent knee pain, and just really enjoyed it, probably because he really echoed my thoughts quite nicely, and it's nice to have someone more intelligent than you help you articulate your intuition. So that was really, really cool. Really well received talk. One that did the exact opposite was the heel pain talk by Dylan Morrissey. Really challenged me, talking around evidence-based approaches to managing heel pain, which included things like taping, right, and stretching and stuff like that, which really challenges my thought process. And it's the one that I'm going to revisit as part of my three-day conferences on my own, right? But I wasn't expecting that to take up so much time. Just ridiculously high quality and high volume information on there. So positivity is how I want to end today's chat and chewing it over. There's some awesome stuff. Have a look at the website. Consider signing up for it. I'd be amazed if you regretted it, if you're interested enough to hear me chat about physio on an afternoon. So get yourself over therapylive.co.uk. And thank you for people engaging on the chat, so I'm not alone on my lunch break. And I'll leave you to it. So thank you ever so much. Fingers crossed that we get some normality over the next month, and stay safe, stay well. All the best.